Hello and welcome to this video. In this video we're going to concentrate more, or I'm going to introduce you to pediatrics and pediatric nursing. Now, when it comes to pediatric nursing, one thing that you should know is that nearly 50% of population in Africa are children ranging from birth to 15 years. Almost all of them are born healthy. Approximately 170 out of every 1,000 born alive die before the age of 5 years. Now, why am I telling you this? I'm telling you this because pediatric nursing usually concentrates on the well-being of children. Therefore, before we start this topic, let's start by looking at some of the definitions that we're going to be having during this course. Okay, so pediatrics. Pediatrics is simply a branch of medicine that is concerned with diagnosis, treatment, and prevention of childhood illnesses. That is the definition of pediatrics. Pediatric nursing. This is a branch of nursing that is concerned with the management of children and their illnesses. So when you're looking at pediatric nursing, we are saying our concern is to manage the illnesses of children, and also to manage children, of course. Then pediatrician is another term that we can come across. A pediatrician is simply a specialist in the treatment and management of children's diseases. A neonate. A neonate is a newborn from birth to 28 days or 1 month. Infant. An infant, this is a child from birth to 1 year. To be precise, that is birth to 12 months. In pediatric nursing, we have what we call as milestones. So milestones, these are stages of development that the child goes through. For example, sitting, crawling, standing, walking, etc., etc. Development, I'm sure this is a term that you're familiar with. Development is the progressive changes in the individual adaptation to the environment, or we can say the progressive increase in individual skill and function. Growth. Growth, this is the increase in the physical size, weight, and physiological basis of behavior through the increase in cell size and number. When you're talking about the increase in cell size and number, of course, we are referring to hypertrophy and hyperplasia respectively. Maturation. Maturation, this is the progression towards adult level of functioning. Okay, so those are some of the definitions and many more that we are going to find. Having looked at the definitions, let's now look at the historical development of pediatric nursing. Now, pediatric nursing was introduced in 1961 by Margaret Duncan. It emerged as a medical specialty in response to the increasing awareness that the health problems of children are different from those of the adults, and that the child's response to disease and stress varies with age. Pediatric nursing covers a holistic dimension to child care and takes into account the children's special needs to growth and development, including the role that the family plays in bringing up a child. It also covers conditions affecting the children and how such conditions can be prevented or managed. It focuses on children as growing individuals with special needs to survive. It was therefore realized that a highly skilled and knowledgeable profession was needed to provide such specialized form of care. It was against this background that pediatric nursing was introduced as a specialty in nursing. So that is a brief historical development of pediatrics. Pediatric nursing has some principles. Let's take a look at some of these principles that you can find in pediatric nursing. One of the principles is that children are immature physiologically, therefore their response to disease is different from adults. They have a very small margin for error. You should start building a sound working relationship with the parents and the sick child at first contact, because first impressions have lasting impressions. Always create a safe environment for the child. Accept the parents and the child as they are. Allow the parents and the child to express themselves. You should also involve the mother or the caregiver in the planning of care of the child, as this will promote bonding. Planning your activities with regard to the age, interest, diagnosis, and limitations caused by the illness. When talking to the child, you should always reduce yourself to the height of the child. This reduces fear and puts the child at ease. Apart from those principles, the other thing that you should do is that you need to have the ability of understanding the child as a developing person with a unique way of thinking and coping with the environment. You should also understand and appreciate the influences of culture and other environmental factors on the stages of growth and development of the child. Make sure that you respect regression and help the child to accept dependence on others. When regression occurs, there is need for the nurse to support the child overcome the negative aspects of regression. Make sure that you be part of the solution and not the problem. Okay, having looked at the principles of pediatric nursing, let's now look at the national health policy of pediatric nursing. One of the national health policies is that child health is one of the most important indicators of the performance of the nation health care system. And the policy statement for pediatric nursing is as follows, or they are as follows. 1. Children should be breastfed exclusively for the first 6 months unless contraindicated. The other policy statement is that all childhood preventive services are free, including diagnosis and treatment of disease in children up to the age of 5 years. That is growth monitoring and immunization. These are free things. I'm sure you've seen it. Nurses, they go through during Child Health Week. They do this. This is a free service. Another policy is that vitamin A supplements are to be provided to all children up to the age of 6 years. Another policy, well child service should be provided up to 5 years of age. Since children under the age of 5 and pregnant women are more prone to malaria, insecticide-treated mosquito nets should be provided free of charge in all government institutions. Prevention of mother-to-child transmission of HIV should be available to all HIV-positive mothers. That is a policy statement. That's what the policy statement for Zambia states. Having looked at the national policy and what the policy statement says, let us now look at the right of a child. One of the rights of a child is right to privacy. Like any other patient, children have the right to privacy regardless of the age. Another right of a child is right to life. Like any other person, this is a fundamental right. This is a fundamental right, and it should be taken to preserve the life of the child. Another right of a child is right to protection from danger. Since the nurse plans for the child's care, the plan should stipulate efforts to protect the child from danger. Right to treatment. The child has a right to treatment and should never be denied treatment or care, regardless of age and illness. We saw or we heard what the policy statement said is that all services to a child up to the age of 5 years are free, meaning the right to treatment is being considered. Right to be fed or right to feed. The child should be fed at all times when hungry. This will promote growth and development. Right to interact with others. The child has the right to interact with friends and the family members. Right to shelter. Right to shelter. Children are born helpless and need to be taken care of by adults, including provision of shelter. We've come to the end of this introduction part or introductory part to pediatrics and pediatric nursing. I hope you enjoyed this video. Please make sure to subscribe for more contents like this.